You are welcome to this module 6 of our continuous lecture on advanced mental health and psychiatric nursing through life development stages. Today, we'll be discussing on the role of psychiatric nursing extended and expanded. This module is divided into 2 units. So we have unit 1 and unit 2. While unit 1 will be running the role of psychiatric nursing expanded and extended. Unit 2 will be talking about another thing. I'll let you know when we get there. But there are 2 units that are incorporated here. So under the role of psychiatric nursing extended and expanded, the objectives here are to understand the meaning of extension and expansion, appreciate the necessity for the expansion, and utilize the role to create her expansion in area of wherever you are serving. All right, introduction. For introduction here, the role of psychiatric nurse, which before now have been localized within where our patients are custodied, and we, the caregivers there, are regarded as custodian of insanities to provide whatever service we have. And so, with the expansion and extension, we are meant to know that our service have expanded, have grown from that locality of being a custodian. It have extended to the level of being a teacher to the students and also the family members, being clinical nurse specialist, being nurse practitioner. You can extend this up to midwifery, because most of the students of the patient, they can have obstetric issues. You can extend it into theater nursing, nurse administrator, and under research. So our role now have expanded from being ordinary custodian to all other realms of nursing practice. Now let's look at the qualities of professional psychiatric nurses. As a professional qualified nurse, where you want your role to be expanded and extended, you are expected to be noble and knowledgeous. You have to be useful to yourself and understand the theme which you are portraying. You have to be self-righteousness and responsible in whatever action you take. There should be a level of simplicity and sympathy. You should be approachable, not rigid to yourself. There should be a level of efficiency and equanimity. This means there should be a level of, you should be able to be quantified. All right, necessity of extending and expanding roles of nurses. get to the realm of acquiring attitude and skill, the need is for us to acquire more attitude and skill in our profession, because by the time we go to study other realms or extend our service to other realms of nursing practice, we want to gain more skill, more knowledge, so that you'll be able to perfect. You should be able to build stronger trust with the patient. You should be able to dictate, prevent, and report any prevailing medical errors. At the same time, we should be able to explore cultural diversities, because in most times where our service is needed beyond our cultural domain, we should be able to adjust your own peculiar custom to suit the custom of the practice of the very client whom you are managing. And again, you should be able to manage heavier case load. You should not be selective cases. And we manage cases that has complex issues and comorbid condition. You shouldn't, as a psychiatric nurse, say, no, they should take him to another specialty. You should be able to attend to the patient and deliver your role until when the patient is stable, then we can refer him to any other specialty based on the priority. We talk about now the difference between extended role of psychiatric nursing. These are the different extended roles we're going to discuss. Extension will reach the level of a caregiver at the caregiving service. You have to plan, you have to implement, you have to evaluate. You extend to a manager. You extend our level, our service to be a protector of the patient. You protect both the environment that the patient is and equally protect his properties and belongings. And whatever is entrusted unto you, be able to safeguard and represent. At the time of need, you deliver to the patient. Should also be an advocate to the patient, the level of government, family, even community. We should also extend our services to be counselors, to be educators, to be communicators. Good communication, you have to be listeners. Good verbal communication, and be able to interpret and understand non-verbal communication from the patient and even from yourself and other caregivers. You should also be able to collaborate. A nurse can be a good collaborator through knowledgeable experience, good planner, that is care planner, good communication in assessment. School health program, we should extend our services there. So our service still extend to occupational health nursing. In some establishment, some industries, they need us. Or when you get there, you develop a plan whereby you'll be able to advise the management on the safety of your patient or safety of your staff, so that they don't fall into psychiatric problem. And so many industries, places of work, where the condition of their service, condition of their activities, one way or the other, hampers with the smooth running of a patient, of their member, their staff. The management may not be interested, but As a caregiver, you can direct them. And most offices which are tampering on the rights of their staff, they don't know, they are not interested. Returning the rights at the appropriate time, exposing their staff to danger. I know there is unemployment, but it doesn't mean that the life of the staff should be jeopardized. We extend our service to public health, hospice nurse, rehabilitation, nurse epidemiologist, and even what we call military nurse. Most of these services you can go on to find out for yourself what is required there as a nurse. We have aerial nurse, we have telenursing, disaster nursing, forensic nursing, nursing in Red Cross Society, sporting nursing, and prison nurses. Let's talk about the differences, the different expanded roles of psychiatric nursing. We have them advanced nursing practice here. You should be able to possess up to masters, which you are trying to acquire, or you've gone already. You are all PhD students aspiring to be philosophers. So you are already an advanced nursing, a nurse practitioner. You possess certificate and expertise in specialized area. Then other fields are clinical nurse specialist, certified nurse midwife, general nursing, general educator, nurse researcher, administrator, and nurse practitioners. These are all elementary stages which we are all expected to aspire before getting to number 1, which we left. All right, these are some class activities I demand from you in order to put whatever we have discussed into action to see how we have institutionalized on them. Another unit we have here is holistic management of psychiatric patient. Our aim of lecture here and aim of study here is to gain knowledge on concept of holistic management, understand components of holistic management in mental health, gain insight on rationale of holistic management, and apply gain knowledge on physical care in wherever psychiatric facility we are delivering care. When we talk about holistic management, it means we are managing the entirety of a client. The entirety there incorporates body, mind, spirit, and emotion. So whatever we are doing, we take consideration, we take into much concern about how this patient, whatever we are doing, how it involves, how it impacts his mind, body, emotion, even extended family. Holistic treatment takes a holistic approach to mental health treatment. Simply mean that the treatment option encompasses all weighing methodology. While talk therapy and medication may be necessary in some case and some level of mental illness, some people may respond very well in alternative methods of treatment and their treatment plan. The talk therapy does its own talk therapy, that is psychotherapy, behavioral therapy, cognitive therapy. They do their own, but there are other ones that you extend through your availability with the patient, with the family, to let them know that you are on ground to deliver and that the patient is safe while under your own care. So it makes the patient and the family to have that trust as they hand over their member to you and go. So a nurse at this level should be able to pray. If it comes to prayer, you should be able to provide when it comes to provision. Though there are certain provisions that you shouldn't temper. Like some of us who are female, there are certain level you shouldn't allow a patient to encroach. When we are talking about holistic care, please, if you happen to be in a psychiatric setting where a patient demand or require carnal knowledge of a fellow staff or demand from you, you have to be brisk and tactful. That is where your care will be restricted, and those are some of the nemesis, some of the dilemmas we are seeing in psychiatric setting. While working, a patient can have desire of you, start to evaluate you the other way. If you notice such a patient, that's why assessment is very, very important. Assess your patient very well. If you notice such a patient, don't ever go into that ward alone. Make sure you are accompanied by 2 or 3. If you have a male nurse, even health assistant who is a male, invite him to go with you while you enter the ward. It's been happening. Likewise, women, when we go in to administer our care, there are some women, you see them open up in the open ward. Their desire, you'll be able to read. So when it gets to that extent, in as per our own ethics, you are forbidden to go that way. So it's not all the physiological needs of a patient at this juncture that we provide. Although we take the holistic aspect, we take the one which are superficial. When it gets to deep emotion, please withdraw. Unless the hospital, because I know now in the advanced countries, they are developing some but there are some provisions in some of the wards what they call where if a married woman or a married man is admitted, is under admission, the husband or the wife can visit. It's called conjugal visit. Such a visit is called conjugal visit. So there will be excused into a private room. If your facility have such on ground, you can release such a person to have a good time with their spouse. But as a staff, please, I try to go extra miles to discuss on this. It is one of the high risk we are always facing in the psychiatric setting. All right, we talk about the rational therapy, recreational therapy, as one of the holistic management of a psychiatric patient. So recreational therapy here, we are want to take or discuss other arms of a client's interest, which will, somewhat we call it diversional therapy. A person will think outside what is his boredom, and it will go a long way to mold his character. So recreational therapy are those arts, the animal play, some sports, the games, either inside or outside. We can introduce dance, drama and comedy, acting out, and community outings. By the time we embrace this community outing, we call it parole. In most times, where we allow a person to be taken out by a staff, by a community member who visits. A staff equally can perform it. We grant a person a parole. We take him around the town, take him around the village, take him out for a stroll for some moment, and then bring him back. Drama and comedy here, there are some persons that do love to partake in watching of game, watching of drama, watching of performance. Even some of the person can act out some of the misbehaviors of the other person. If a person is a talkative, if a person is a bully, a person is a kind of person that used to fraud others, he can be put into comic play, where if he is act out, by the time a person watches that play, you know that whatever they are doing there concerns him, and then he will denounce or desist some of those behaviors. So it's still part of our holistic nursing. This one is called equine therapy. Equine therapy relate with those who have something to do with the horse. Equine therapy is a form of treatment where individuals walk through their issues by developing a relationship with horses. Clients work with horses to develop and prove self-esteem, address fear and anxiety stemming from trauma, and practice empathy. So as they climb the horse, they ride the horse, they gallop over it, they forget about most of their issues. We also have art therapy that involve drawing, sculpting, printing, collage, and photography. All this draw the attention of a person from his worry, from his boredom. It's most recommended in depressive therapy. You can introduce this. But what I advise us is, before you introduce this, let it be that the patient have come out of the psychotic phase which he or she was. He should no longer be shouting, screaming, running out of for fear of hallucination or persecution. By the time you introduce, if it's out of this phase, and then you introduce this art therapy, it will be very appreciable and recommended for the patient. We have music therapy. In this music therapy, we can organize patients, those who can sing, to sing his favorite music, his favorite song to him. Or if you can record some songs, either in our phone gadget or in television or in radio, whatever form, then you put it on in the word and you invite them to listen to it. If it's a type of his favorite, he would enjoy it. He will go on with it, and then some of his depressive thoughts can be thrown away. We have this yoga, what they call yoga play. I have not seen this before, but It's most practiced in China, India, and all these other countries, even Japan. They are most familiar with it. I've not seen it introduced in this part of our psychiatric practice, but it's equally part of recreational therapy. Yoga therapy program is designed to heal and strengthen the body, mind, and spirit. Yoga process can be easy to do and can improve your overall well-being as well as other physical and mental benefits such as increased flexibility, muscle strength and tone, improved breathing, energy and vitality, which the doctor, I have not seen it done yet. That's why I can't really explain it, but I learned it is very recommendable in a psychiatry setting. So those of us who have opportunity to practice our psychiatry outside Nigeria, I think we will embrace this the more. So these are general benefits of holistic mental health treatment. It develops and nurtures, it creates mind-body connection. The tool and skill are applicable in management of stress, conflict, and environmental triggers. It relieves stress, relax tight muscle, improve immune system, creates sense of self-worth, increase mental clarity, reduces boredom and anxiety, maintain physical health and well-being. All right, that is the end of the lecture, and I wish you try and do these class activities. Suggest other form of holistic management of psychiatric patient. Yes, there are some other holistic management whereby in that game, it can be indoor game, it can be outdoor game. We can include graph. Graph is not here. We can include Ludo. We can include football, which is outside. You can include table tennis. It says state physiological actions occurring in the body during massaging. We didn't include these two. It's for you to go and find out. Massaging equally help. It sedates. After the exercise, the patient sleeps very well. But be careful whom you massage. Educate parents of sleep disorders on use of diversional therapy. So these are some of the group assignment which we can, as a group or individual, we raise it and submit. It builds up so that if any question is raised toward that aspect, we'll be able to tackle. These are the references I use for the work. I thank you for your attention. Till next time.